Mr. Thank you. Thank you. Thank you. Thank you. So, hello or good afternoon and welcome to the Adult Social Care panel of Stirling Council. So this is a remote meeting. It is being live streamed on YouTube, and a recording will be available for viewing on Stirling Council's website after the meeting. So the usual protocols will take place. So if you could keep your microphone off when you're not speaking. If you wish to speak, you use the raised hand button and then put your microphone off again when you've finished. So could I ask Karen to take a roll call of the members present, please?
Thank you. Councillor Flanagan?
I'm here.
Thank you. Councillor Houston?
Present.
Councillor McGill?
I'm here.
Councillor Simpson?
Present.
I've received apologies for Councillor Errol and Councillor Tolomash with no substitutes.
Thank you.
With 4 members, that meets quorum.
Thank you. I think, did Councillor Laurie submit apologies?
I haven't received any apologies from Councillor Laurie yet.
Okay. So moving on to declarations of interest. So I would like to declare that I'm a member of Commencement and Stirling's Integration Joint Board. There's general dispensation from the Standards Commission for Scotland, and therefore I feel able to continue with the meeting. I'm also a member of Forth Valley Health Board, and specific inclusion applies under the Council's Code of Conduct, and therefore I feel able to remain and participate in the meeting. Could I invite any other members if they have declarations of interest? Councillor Houston.
Chair, similar to yourself, I'm a member of the Stirling and Clipman Integrated Joint Board. Thank you.
Thank you. Any others? No. So moving on, item number 3, urgent business. There isn't any. Moving on to item number 4, the minutes of the previous panel, which was held on the 8th of December. So we just check this for accuracy. So page 1, page 2, page 3, and page 4. Are we happy that's an accurate record of that meeting?
Agreed.
Agreed, yeah.
Yes, thank you. Moving on then to item number 5, which is the role and action log. Does anybody have any comments or questions about the role and action log? No. So we're happy for that to go forward. Okay, thank you. So moving on again to item number 6. So this is a presentation of the South West Stirling Rural Model of Care. And is that yourself, Caroline, that's going to present that?
It's actually Leslie. Leslie's written the paper and done the presentation. So Leslie's going to present it, but I'll support Leslie with any questions.
Okay, thank you. I should have said at my intro if the officers could say their name and their title at the start of any item. Thanks.
Good afternoon, folks. My name is Lisa Shaw. I'm the Service Improvement Manager for Commencement and Stirling Health and Social Care Partnership. If you just bear with me a second, I'll share the presentation with you. Can everybody see the slide? Smashing. Thank you for inviting me along to present to you this afternoon. As the Chair explained, I'll be explaining to you our approach to remodernising the rural model of care, particularly in our rural southwest Stirling communities. So I'll just move on. So the background really so far, I joined the partnership in just at the end of last year. And so there's a bit of work that has been carried out previously. There had been some community engagement work that actually took place in September 2020, which I'll come on to. Also my colleague David Niven, who's with us on the call, he had carried out some rural southwest Stirling consultation work around December, and this presented this in June 2021. Again, we'll also be covering that a little bit through this presentation. And yeah, I want to take that forward. So the previous engagement we spoke about This was carried out in around autumn 2020. This was quite an interesting time, obviously with the pandemic. I think probably at that point we were maybe hoping that we were starting to move out of that phase. However, that didn't quite materialise as we would have liked. But the early indicators through some of the engagement work that were carried out across the 3 localities, I've highlighted the Stirling Rural just because that's the reason why we're all here today. And the early indicators that came from those consultations that people wanted to have or see more of from the partnership was more around care closer to home, improved access to health and care services within their community, and good public information. So I don't think there's anything there that's particularly shocking to anybody, but it reaffirms what we want to do and the way that we want to work going forward. As I'd mentioned, though, that's really just the beginning of this adventure, I suppose, that we want to embark on, because things have changed. Obviously, the pandemic's went on much longer than maybe some of us would have anticipated, and other changes are affecting community lives just now. So that's really why there's been a bit more of an in-depth focus model of care, particularly around the rural southwest. And this is the work that my colleague David Niven had carried out at the end of 20 and into 21. Obviously, there's been a little bit of a delay there just through the second wave of lockdown at the beginning part of 21. But there was quite a substantial amount of work that was carried out, excuse me, folks, which was really working closely with the communities to adopt what it was that they wanted and what they felt they needed to help keep them safe and at home in their communities as much as possible. And as you can see from this work, that re-enablement is a really key area to this, and making sure that people can get home as quickly as possible and that they are fit for living life safely at home. Also SDS, the Self-Directed Support Scotland, is a really key point here in opening up the doors. We've now got a new lead officer who's just taken up post, again, along with myself at the tail end of last year within the partnership, who's going to be working really closely with myself and the other managers to make sure that the options are explored as much as possible. People are aware of what opportunities are there for them to help with caring roles. I think as well, the digital aspect has been a huge area that's kind of forced people, I think, who maybe were being a little bit more resistant to digital work throughout the pandemic, and realising that the opportunities that brings and how we can capitalise a little bit more. Obviously, David will be speaking a bit as well about the shift from analogue to digital as well, and how that relates to this new working model. So I think this is really quite an apt picture to show, and really details in such a way that we know what we want to listen. We are listening to our residents, our communities, and how we can work with them to deliver a model of care that's fitting for them. The recommendations that come through the Rural South West consultation work that David had carried out was the re-provision of bed-based respite care and looking at local assessment. So that's going to be something we want to prioritise, I think, through all these recommendations going forward. Looking at recruiting a short breaks coordinator who can help facilitate that, and working with the third sector groups to see what other sources are available for carers to support them in their role. And looking at working with our community development colleagues to see how we can work at I suppose co-producing solutions to tackle some of the issues in communities. Some of the feedback that came from the community consultation in autumn 2020 was around infrastructure in communities and how can we make it more fit for the older living population as well in some of our rural areas. So that's something we would maybe want to look at. Looking at something like participatory budgeting as well can be a really good way of using that tool. Again, just encourage that and support the levels of connection and engagement with carers, make sure everybody who knows they're well connected, not just within our working teams, but within the communities of what options are there, because there are lots of resources, but it's knowing who's available and what's applicable to them, and how we can get the funding for that to support them. And obviously our self-directed support worker will be really key in that work. This has been quite interesting at point number 5 about the up-to-date mapping of activities. This is something that comes up again and again in various different consultations, because things can quickly change out of date. So I think it's something that we want to make a priority, that there's a constant review of that and how we can get something really up to date, but also really collaborative, but also comprehensive in terms of all the activities and groups and things that are out there. So that's something that we're going to be working in partnership with as we go forward as part of the locality plans. And working with our active travel colleagues as well to look at how we can Transport's obviously a big issue for a lot of our rural communities, and seeing how we can work with them to sort of try and navigate around some of the challenges there, but also some of the opportunities as well, because there's some beautiful countryside out there, and that's obviously a reason why so many people want to live that rural lifestyle. So how can we enable them to do that in a safe way? And also flagging these issues up when it's applicable to our community planning partners, to take them into consideration as well in our police team. So really, my approach, I suppose, coming into this role, I guess it's quite, you know, apt. We're in the springtime. People are kind of emerging, coming from winter, and maybe feel a little bit more ready to engage in community life again. And hopefully with the sort of easing of COVID restrictions as well. So we're really keen to be going out, and I've made initial contact with our community groups to meet with their community councils and really discuss where we could pick up from the work that David and his colleagues had carried out, and look to see how we can mobilise this next stage of the consultation and engagement. And that will obviously be meeting with a lot of the community groups, getting to understand their communities and fostering really good, strong working relationships. I think my particular background in community development has always been that frustration sometimes when people want to come out and speak to you in a particular consultation at that particular time, but then you don't have any relationship there afterwards. So that's something that I very much want to change, I think, going forward in this role, and that there's an ongoing relationship there, and that there's that two-way listening and communication. And I think, sorry, excuse me, listening and like I said, being able to understand what the communities needs, because they will be ever changing. And I think even as we ease out the pandemic just now, there's no shortage of challenges that are still facing our communities with the cost of living and things. So we really need to make sure that we're receptive to that and doing everything that we can to support them. I think a good way of being able to ensure that we can listen to our communities is by creating a Rural South West forum. So we have a regular place and commitment set up for those discussions where people can come forward. But I think certainly within my role, I really we're trying to create an open door policy as well, where communities can reach out to the partnership whenever they feel they need to. And I think really as well going forward, particularly because the Rural South West is such a sort of unique community, and setting up a working group around there so they can really be part of this journey and taking forward how we are going to create this new model of care that suits them. I mean, it'd be a bit foolish, I think, of us to want to go ahead and implement something without their knowledge, their buy-in, and their commitment to want to take forward this new way of working in communities. So I've just put up a little timescale there. I'm not entirely sure how clear that will be at your end, so I can send forward the slides afterwards. But it was really just to show a bit of a timeline of where we've come from in this process and how we're going to be focusing on it, certainly in the spring and into the summer period of 2022, and how we're going to work with our colleagues and also with our residents in the communities to take forward the plans and hopefully set up a working group to establish a project going forward to come up with some new initiatives to see how we can deliver this care closer to home in our rural communities. Really with the outcome, I suppose, I guess, of being able to create a model that's really fitting for our communities. It's not something that's been imposed upon them, but something that they feel that they have adopted and they've been part of, and that is the right fit for their community. And it is adopted by the partnership, the IGIB, and as I said, the communities as well. And ultimately that will make them really resilient and empowered, that they have had that say and influence over what kind of care is delivered and how we use the resources that we have. And I think this is just quite a fitting picture, I guess, with the Balfron Community Choir there, and showing that sense of togetherness, and that people are feeling healthy, supported, and can connect with one another in their areas. And I think just now, certainly through the pandemic, that's proven really, really crucial, and for all well-being and reducing the social isolation as well. So that is the end of my presentation. I'm happy to take any questions.
Thank you, Les. That was very interesting. I'll open it up. Does anybody have any questions? Councillor Simpson.
Yes, thank you very much for that. I was actually around at the inception of the Belfield Centre, and it was intended primarily to be there for reablement, to get people back into their own homes. And I was wondering, is it still exclusively for reablement, or you talk about bed-based respite care? Do you have some respite care beds that are used in the Belfield Centre, and if people don't go there for respite care, bed-based respite care, where do they go?
Caroline, I see you have your hand up. Would you like
Yes.
to come in?
Yes, thank you, Councillor Simpson. What we're trying to do is we're trying to create a mixed model so as that people have the choice, and also look at that crisis care as well for when carers are in crisis. So we've now employed a short breaks coordinator that came out the consultation last year. So that person is now in post. We've been a little bit slow to get off the ground, unfortunately, due to pressures and demands with our other services due to COVID and the implications that that's had on us. But certainly you are correct. I think that I wasn't around when the model was set up. However, what we do is we try to ensure flexibility. So what we call step up and step down. So if there is a crisis in the community, we would look to where is the best place for us to step up. And part of the Southwest Rural Consultation was also about having, if you like, secured respite beds in the community, as opposed to people having to go to Stirling. So sorry, my phone's just going. So it's about people. So if it's rural Southwest, we would be looking to engage and discuss that possibility of the local people who live or who operate businesses within that area. So that might be, for instance, Blainfield, etc. So that's the position we're trying to get to. We're trying to get to the position where we have flexibility in the service and we have spot purchase or protected beds in the localities, as opposed to everybody going to the Belfield. Because one of the things about the feedback from the people of rural Southwest was that even going to the Belfield was quite challenging for them, trying to get there, particularly if they were reliant on public transport or their communities. Thank you.
Right, so you're saying that it would be private beds in beds in private residential care?
Some of them, they're not all private. Some of them are, there's a mixed economy out there. So, you know, we're running some care homes at this moment in time. There are, I think, and please excuse me for the geography, there is one of the care homes is run by the cooperative. The name has gone straight out of my head. And yes, there are some others that are privately owned, but it is a mixed economy that is out there. We certainly have used Belfield beds as step-up beds and crisis care beds. And if there's beds there, we would do. The difficulty that we've had with the last 2 years is due to the pressures in the hospital. We've had to support the hospital with bringing people down out of hospital because of the lack of acute beds that are available due to demand.
Right, thank you very much. Thank you.
Thank you. Councillor Houston.
Thanks, Chair. I think, like Christine, was around at the beginning of actually at the conception, if you like, of the Belfield Centre some 12 years ago, and it has moved away from the initial planning, because we talked about a care village and that setting and all these sort of wonderful things. But it was very much about respite care, and it was about step up, step down care as well, because that's important. But I think in this paper we need to think post-COVID. We need to get our thinking about, we've been badly affected by the past 2 years, but we need to put our thinking on beyond that, about when we're back into running with the normal challenges, if you like, which are severe enough. So I welcome the proposals that are in the paper, and I think that gives us the flexibility that we require. We can't be too rigid about all the things that we'd like to do. Given a big enough pot of money, there's lots we'd like to do, but with the constraints that we've got, and even with the talk of a national care service, that in itself is talking about at least 2025, 26. We can't wait that long. We have to do things now to improve the services that we're providing. So I welcome the content of this paper very much indeed. Thank you.
Thank you. I would agree with your sentiment there, Councillor Houston. Does anybody have any further comments or questions? No? So the recommendations here, we were asked to note the outcome of the previous consultations and note the proposed next steps. So I think we can agree we've done that. Yes. Thank you very much. Thank you, Leslie. So moving on to item number 7, we've got the update on the analogue to digital switchover. Is that yourself, David, that's presenting that?
Thanks, Chair. I think it's actually Ewan. Excuse me, Ewan's going to give a brief introduction and then pass over to me. Thanks.
Okay, thanks. Ewan, over to you.
Thank you, Councillor McGill. It will be a very brief introduction. David's got far more detailed technical knowledge around the issue than I do. However, the committee had asked for an update in the progress around analogue to digital switchover. We do need to make this change in the near future, given the pending switch off of some of the analogue or all of the analogue lines over the coming years. It's a significant project and a significant piece of work. David's been, excuse me, supporting the development of detailed business cases for the capital investment required. Those capital investments are for the council's consideration within its wider budget setting considerations. The paper also refers to our bid for some project officer support through the Digital Office for Scottish Local Government. I'm pleased to confirm we've now got confirmation of that funded support. There'll be no new analogue lines available after September next year, September 2023, and some of the lines could be switched over before that date. So we do have a need to move quite rapidly from the platforms we're on at the moment to future fit for purpose platforms and that are digitally enabled. That also fits with our wider future approaches around enabling wider technologies around technology-enabled care and the future modernisation of our social care services. Thank you. I'll hand over to David to take you through some of the more detailed information now.
Thanks very much indeed, Ewan. So I'm happy to take questions at any point during this, but I'm also happy if you want to hold your questions till the end. So Ewan's given a really helpful sort of set of boundaries as to where this project fits. It's essentially a response to a national infrastructure change where all the telephone exchanges across the country are being switched over to digital signalling, and that then affects the equipment that the 4,500 service users across Clackmannanshire and Stirling who use the MEX, the Mobile Emergency Care Service, have within their house. So that's the wee buttons and the boxes and the pendants and the various connected devices that they have in their house that speak through the phone line to the alarm receiving centre based at Stirling Council. Customer First and Customer First serves both the Clackmannanshire and the Stirling area for this. So in essence, the project is about this changing and putting new digital equipment into every single service user's home and making sure that equipment works. I suppose it's worth saying as well that there was a paper about this project came to your last meeting on the 8th of December. I think one of the questions that one of the reasons you wanted to hear about it again so soon was to do with the Digital Scotland bid that was in place at the time, and as Ewan has confirmed, that funding's been made available. So that's for one full-time equivalent project manager for a period of 18 months to cover Clackmannanshire and Stirling. And we got advice during December that we were successful about that as well. Underneath, when it comes to the rollout, there's an element of uncertainty about some of this. We get roughly 6 to 9 months advice from British Telecom as to when they plan to switch an individual exchange over. So we don't actually know this time next year which exchanges will or won't be digital. So and that rule goes all the way out to December 25. So part of the project will have to be planned and part of it will have to be responsive. It'll need to be a mixture of both. But we think with the project as planned there's now a substantial business case around about this for the delivery of this project in Stirling that helps to explain how that can be rolled out and the various costs associated with it. So as well as having the funding secured and started the HR process for that job, the project manager job descriptions currently being evaluated in both Clackmannanshire Council area and Stirling Council area, and having a robust business case in place in the Stirling area. We've also been working on, there will be a separate procurement in each of Stirling and Clackmannanshire as well that links in with the colleagues within the reablement and MEX services in each of Stirling and Clackmannanshire. So it'll be 2 parallel projects being rolled out with a shared learning across the one project manager and the one working group, which is what we're calling the project board for this. There's a whole load of detail that I can respond to or answer questions about, but maybe err on the side of saying less initially and responding to any particular questions you have, and I'm happy to elaborate on any areas that you'd like to know more about. Thank you.
Thanks, David. So Nicola, for me is the connectivity. What do we do? Is there a backup that going to ensure that people are going to be connected at all times? Because in the digital, having to use virtual things here, there's quite often connection issues. Just wondering how that's going to affect this system.
So the new digital system won't run over the digital landlines. So although the landlines are switching to digital, the new MEX systems that go into people's houses will run over the digital mobile phone network. So they'll be effectively, they'll have a SIM inside them, but they're able to roam across all of the networks. So they're not tied like your phone or my phone would be tied to an individual provider, but these are available to be tweaked to pick up the provider that's providing the best signal at the time. So in that respect, the expectation is that the resilience will be higher. However, we do know that there are circumstances when the mobile phone network and mobile phone networks can go down as well. And in actual fact, it's a result of this technology switchover that's happening at a national level. Is that the advice from the Scottish local government or Scottish office, Scottish Digital Office for Scottish Local Government, is that that the mobile network-based mobile emergency care service system is likely to be the most durable. They're not recommending that we go down the digital landline route, that we use the mobile route. And especially for more remote rural areas, that ability to go across networks would seem to be really important.
Okay, thank you. Councillor Houston.
Thank you, Chair. It was following up on that. Can I ask David, we've got 4,000 users. Are we able to ensure that they are all in locations where a signal of some provider is available? Because there are hotspots and there are not spots, as we know, and the geography of Stirling and Clackmannanshire is such that there are areas where reception is difficult, where some communities have had to put in their own kind of broadband, etc., because they don't have access to the public services. So will it be a case of actually testing out each one of the 4,000 applications that we have, that they actually work in situ? And if they don't, is there any kind of backup that we do for that?
So the project includes a workforce that will go out to each individual service user's home and install the equipment and make sure that it's working. So I suppose your last question first is answered there, in the sense that no one will be receiving something in a post and be expected to work out how to make it function for themselves. It'll be a human being from the reablement and MEX service that goes into their house, and they'll not rest until it's sorted. When it comes to, will there be an individual specific location where for some reason all of the mobile networks don't have sufficiently strong signal? That is a possibility, but it wouldn't be the end of the story then. It would be a matter of linking in with whatever other local responses there are to that problem. So you've mentioned that there's some of the more remote rural communities who have established their own Wi-Fi networks on a larger scale to make up for the absence of good quality broadband and so on. And I think then it becomes a matter of working out how this generic digital kit within the individual's house can be best plugged into the local infrastructure. I think it's unlikely to be a matter of it being impossible, but there may be a few sort of marginal or sort of at the edge cases where we have to think a wee bit more creatively to get it to work.
Thank you.
Okay, thank you. Is there any more questions or comments on this? No. So the recommendations here were asked to note the progress, and no doubt we'll get a further update further down the line as this develops, but it's very interesting to see that it is developing at a pace. So thank you for that. And now we're on to item number 8. So this is the Health and Social Care Partnership Transformation Plan. Is that yourself, Ewan?
Yeah, thank you, Councillor McGill. Again, I'll introduce and call on David to support some of the more detailed implications. As the paper describes, we re-established or reinvigorated the transformation plan during 2020 as a health and social care partnership, and that resulted in reviewing the membership and the terms of reference of the Transforming Care Board, of which there is representation across from all the constituent authorities, and that then becomes the locus of how we deliver the plan, and the reporting from the Transforming Care Board then goes to the IGB in terms of assurance and monitoring of delivery of the plan. Obviously, some of the elements of our plan transformation have been significantly affected over the last 2 years by the impacts of the pandemic, but actually there has been a considerable amount done as well during that process, and actually the pandemic has resulted in us having to be more agile and adapt to plan from the learning that we've experienced over the last couple of years as well. The overview of the plan is brought to you today for assurance and for some information and oversight of the range of activities involved. Thanks. I'll hand over to David at this point to take through some more of the detail.
Thanks very much, Ewan. Chair, I should say as well, I omitted to respond to your request at the beginning. I didn't introduce myself, apologies, but I will rectify that now. My name's David Niven. I work for Stirling Council, and my role is Adult Social Care Portfolio Lead. So I'm based within the Programme Management Office at Stirling Council, as opposed to being an employee of the Health and Social Care Partnership. And so sorry for not mentioning that earlier, but my role is fully 100% of my time is spent in support of transformation work and the Health and Social Care Partnership. And that was triggered. That I reminded myself to do that simply because this piece of work around about the transformation plan is very core to my role within the Programme Management Office and my role in supporting the partnership to deliver transformation. So in essence, the transformation plan is the snapshot of the portfolio of projects and programs that the partnership has identified as priorities to deliver its strategic plan. So it's about being clear about what the projects and programs are, particularly around about who's accountable in terms of a sponsor for each project and program, and who's responsible for the delivery in terms of the senior responsible owner of the project, making sure that each project has clarity around about the benefits that it's trying to achieve and the risks that it is exposed to help it to maximize its ability to deliver as expected. And then the mechanism, again, as you'd expect, for governing that is through the Transforming Care Board, which has a place in the, if you like, in the governance of the IJB below the Performance and Finance and Performance Committee of the IJB. The advantage with the Transforming Care Board is that it's senior representation from all of the constituent bodies. So I suppose I want to just give you confidence around about the structures and how this works. You'll be familiar with project and program delivery, but I suppose it was just to try and give you that overview. And so there's a clear pathway for escalating issues and for making decisions and addressing areas that need decisions handed back down to projects and programs. And in particular, to give you confidence around about the risk side of things, where there's a comprehensive portfolio level risk register that both reflects emerging risks coming up from projects and programs and portfolio wide, partnership wide transformation risks. It's not a substitute or a competitor with the IJB's overall risk management process. It's got a focus on risk related to the Transforming Care Board and the projects and programs that sit underneath it. And that's one of the primary mechanisms that we use for ensuring that that the governance is aware of and alert of the things that they need to be, and that projects and programs stay on track. So again, at the risk of not boring you too much with me talking about it, I'm very happy to take questions from here on.
Thank you. It's quite a comprehensive list of in the plan, and I'm really interested just if you could give us a flavour of the integrated housing programmes and how that's all developing, because there's quite a few mentions of that in different descriptions.
Yeah, you're. I see what you're saying there, Chair. Certainly, I think one of the real opportunities within health and social care integration is to recognise the legislation's reference and expectation that housing isn't forgotten about within a view of health and social care in general. What I would say about I think it's 3 different projects, programs relating to housing that are on the transformation plan, is that they are, if you like, awaiting or requiring additional resource. And you'll maybe have noticed that there's reference to a health and social work policy post that that the expectation is, it's more than a hope. I think we're at the point of getting there. That'll be funded, and maybe Ewan's in a better place to speak about that, but there's an expectation that funding will be available from the constituent bodies, because the existing workforce struggles to get that to stretch itself that far to cover the housing element as well. But there's a real opportunity there.
Okay, thank you. Ewan, do you want to come in here?
Yeah, it's something we are looking at. We've identified a real gap in terms of that kind of specialist housing policy interface, if I can call it that, between the councils and the work of the Health and Social Care Partnership. So we're looking at various options to fill that gap, and there potentially is something around looking at it from the point of view of actually the benefits would accrue to everybody. So should we all be kind of putting a bit into to help kind of untap that potential going forward? There's also quite extensive work around new models of care and supported living models of care, particularly around learning disability, some of which are coming on stream in the very near future, almost live as we speak. So some of that change is working and actually happening anyway as we speak. And there's just finally for me something around just remembering the strategic priorities of the IJB and Health and Social Care Partnership, and the transformation plans deliberately structured to show that kind of line of sight between what we're trying to do and the strategic priorities, and how those achieve better outcomes for our people in terms of care closer to home. So we want to support people to be at home or close to home and homely settings as much as we can, and that kind of ongoing shift away from residential type care, where we can do it safely and effectively. Thanks.
I would like to continue that conversation, and I wonder if we could maybe do that offline. I don't know if you're able to stay. Maybe Caroline and David could stay after we finish this panel and have a discussion. Thank you. Councillor Simpson.
Thank you, Chair. I'm very impressed by the range of provision that's now available in this field. I would like to know a little bit more about the hospital at home concept. The multidisciplinary care team, is it well resourced? Because I know that there is a shortage of consultants in the NHS, but are you able to recruit geriatricians to come on board with that? And I see that the team has been in place since September 2021, and I wanted to ask if it's making a difference to the admission rate to hospital, and is it impacting on the problem of bed blocking? I don't know if you all have had time to make any kind of assessments or research into the effects, but I think it's an excellent concept.
Caroline, you have your hand up.
Yeah. Thank you, Councillor Simpson. So hospital at home is something that I had been involved with previously, and we recognised a need to deliver this locally, and also just given resources and challenges, and also just bearing in mind what Ewan was saying there about care closer to home. So hospital at home as a model of care we know works, and actually it's about supporting people in their own homes, in their communities, and avoiding that admission, which for some people can be quite upsetting and quite debilitating. And we know that the longer people stay in hospital, the more their rehabilitation decreases. So and that we had an ECT team, so the emergency care team, and so effectively we had the resources there to transition to then develop the hospital at home team. We have a geriatrician that leads that team. We have had challenges in recruiting it, but there has been challenges across the NHS, the whole system. I don't have the figures to hand, I'm really sorry, but it is doing really, really well. As you say, we are keeping people out of hospital, so the referrals come through GPs. They're discussed then with the geriatrician. The geriatrician then assesses, actually, is this something that we have the capacity and that we can manage in the community? And then the other side of the coin is we have been able to get people out of hospital much quicker, because there has been sometimes that flexibility in order to take somebody home, and for the hospital at home team to just support for a little bit of time, as opposed to maybe going to district nurses. And the good thing about over the last couple of years, or the last year in particular, about that flexibility is that, say there was high rate of staff absence in one area, potentially due to COVID, it meant that the teams in the community had that flexibility to fluctuate between them. So, maybe hospital at home were maybe managing something, and then they would hand over to district nurses, and vice versa. So it's really wonderful to hear and listen to the depth when they're having their multidisciplinary teams. It's really wonderful to hear that flex and that whole system working, from the GP to the geriatrician to the district nurses to the carers, including our own kind of reablement services in the community, and then to hospital at home. I don't have the figures, and we can certainly get the figures and we can bring them back to you, that estimates the numbers that they're managing. I think we increased it from about 15 patients per day that are seen. We've increased that. So that's what they're saying. They're saying about 15 to 20, I think it is. Please don't quote me though, but we can get those figures for you. So they're seeing that number of patients. It's a virtual ward. And they're seeing that number of patients. Yes, there have been challenges with staffing. I don't deny that, but there is not one sector, I don't think, across the whole health and social care plane at this moment that hasn't seen challenges with staffing. But you're absolutely right. It has been well received. It's been the feedback from the communities, and particularly the people who they are supporting, has also been excellent, that they've been able to stay in their own home as well. But we can get, and they are keeping their data performance, and we can get that to you and bring that back at a future date.
Thank you very much. Thank you.
Thank you. Yes, just you know, the next item we're coming to is a work plan, so I think that's definitely maybe one that we could add to that. But it sounds very interesting. Councillor Houston.
Thank you, Chair. Just following up on that, I think it really sounds like a good news story, and that continuous care and the kind of one service provision is excellent. But given that we're both stopping people going into hospital and allowing people to come out of hospital that little bit earlier, is having a major benefit on the NHS themselves. So I wonder, notwithstanding the availability of staffing resources, which I understand is challenging, what about the actual financial resources to fund this? Is there any money coming from the NHS in recognition that what we're doing is providing support to them in terms of bed usage and bed uptake and freeing up bed space for them?
So I was going to say I'll maybe let Ewan come in, but certainly it is a joint funded project at this moment. But I'll let Ewan give you the detail.
Thank you. I think it's one of these things that, in theory, what you say, Councillor Houston, would be exactly what you'd expect to happen, and we are, through reporting, making sure we capture the kind of use the language of whole system benefits, because actually we are a whole interdependent health and social care system. I guess just to counsel that slightly, what we are seeing and what we have seen in recent months, particularly since around last August, is an exceptional level of demand increase across all the services, and particularly front door A&E services and the hospital sector. And that has resulted in significant additional pressure on the acute hospital service in terms of bed capacity. We remain under significant capacity capacity constraints as a whole system, and that's not unique to Clackmannshire, Stirling or Forth Valley. That's being felt across the country. There'll be a number of things contributing to that, and it's hard to attribute the cause and effect to any single thing, but there's certainly some evidence that people became more deconditioned through the lockdowns and are presenting with higher acuity of needs when they do present at the hospital. There will have been issues around normal health screening services and delayed presentation at hospital, and again leading to more complexity of needs. I think what is important is that we know there's still potential to untap around some of these things, and we do quantify the benefits going forward and work as a whole system to make the whole system sustainable going forward. We would hope to see some of these pressures dissipate in the coming months. They'll obviously have been, particularly in recent months, exacerbated by the most recent wave of COVID as well. But what we're not seeing is significant free capacity in the hospital system. In fact, we're seeing opposite, continuing reliance on contingency bed capacity despite us doing all this work, and that makes you kind of wonder, if we weren't doing it, how much worse it might be. So that probably doesn't give you a convenient answer, but it reflects the reality we continue to work within. Thank you.
Thanks for that. Can I just come back, because I absolutely agree it's a whole system approach, and the whole system is under pressure. And the pipeline is absolutely full. So as soon as we empty a bed, there's another 2 or 3 people waiting to get into it. Understand that. And Caroline said this was jointly funded, and I'm pleased to hear that. But do we have guarantees about the funding going forward? Because if this is working, then no doubt we want to keep it going, because it keeps people at home. It's where they want to be, and the quality of care has been well received. But in a whole system approach, my experience is it doesn't come down to whole systems budgeting. Getting money out of the NHS and into the care delivery side of things, which for me is still part of care, is enormously difficult. It doesn't seem to be a whole system when we come to talk about cash. So have you got any assurances that that support will be ongoing?
So our intention is to continue that funding of that service going forward. We'll need to consider all those considerations in the round in terms of how the IGB sets it as its budget going forward. There is certainly some expectation from government that with some of the additional funding flowing through the recent Scottish Government settlement, we look to enhance that capacity in the community going forward. We are developing within the IGB, will be part of the IGB's considerations, some key business cases around how we enhance the wider capacity in the community, which has been challenged in recent times as well, and is experiencing the same, if not more, level of demand pressure. It's all aimed at doing the right thing for people, and that should have financial benefits for the whole system going forward. We do need to make sure we report and capture those benefits realisation, and try and then recycle that money in terms of what we use that for going forward in terms of alternatives. Thanks.
Thank you.
Thank you. If there's no more questions, we've been asked to note the progress of the transformation plan. So I think we can say we've done that. So moving on to the last item on the agenda, item number 9, is the work plan. So we've got a few items there. I suggest we would maybe want to add the hospital at home for a later date for a further update. Is there any other items people would like to go in the work plan? Marie.
Marie Valenti, Chief Social Work Officer, Stirling Council. It's not a new item, Councillor McGill, but it's just to say that I've already met with Nicola Cochrane, who's the new Mental Health Manager in the Health and Social Care Partnership, Simon Jones for the ADP, and my lead officer for the Promise, Morven Beattie, to have a discussion about the content of the next presentation. So they are more than happy to come along and talk to this group, and it's particularly relevant for the ADP because there's whole family support policy that's come out also with some funding attached to it. So just to say that is already in train, and I'll be happy to come along and contribute at that point as well. So thanks.
Okay, thank you. Well, that then brings us to the end of this meeting. So I'd like to thank you all for coming, and it'll be a new panel that arrives after the local government elections. So I'd like to thank everybody for all their presentations, the papers, and all the questioning over the time. And certainly the social care panel has evolved in the last few years. And no doubt we'll do again with the National Care Service coming on board in the not too distant future. So thank you very much, everybody. I wonder if Councillor Simpson could wait, and you and Caroline, please. Thank you.
Thanks, Chair.
Thanks, Chair.